going to move on now to the next item of business, consideration of Business Motion 21992 in the name of Graham Day on behalf of the Bureau, setting out revisions to this week's business. Could I call on Graham Day to move this motion?
Move, Presiding Officer.
Thank you very much. No member has asked to speak on the motion. Therefore, the question is that motion 21992 be agreed. Are we all agreed? Yes. We are agreed. Thank you. The next item now is topical questions. So I'm going to turn straight to the first question from Miles Briggs.
Thank you, Presiding Officer. To ask the Scottish Government for what reason it did not immediately publish details of the number of patients who have contracted COVID-19 in hospital.
Cabinet Secretary Jean Freeman.
Details of the total number of COVID-19 cases and deaths in each NHS board are published daily. Last week, we published initial unvalidated data on the number of suspected nosocomial COVID-19 incidents. The challenge is that in all of the data on nosocomial infection, it is not yet clear whether all of the individuals involved contracted the infection in the community prior to admission or within hospital. This unvalidated information is a compilation of reports from health boards and shows that there have been 125 COVID-19 incidents which are associated at the moment with a potential 901 patient cases, of which 870 are confirmed COVID-19 and 31 are suspected, and sadly 218 deaths. In addition, the same unvalidated information indicates 894 staff cases, including both confirmed and suspected COVID-19. However, this position is very far from definitive at the moment, not least due to the long incubation period of COVID-19, as is recognised by the European Centre for Disease Control. So I want to make as much information available as I can, as soon as I can, and that is as accurate as possible, and I will continue to do that. But as I said in my letter of the 4th of June to Ms Lennon and in the GIQ published on the same date, these are suspected transmissions, and to suggest otherwise would be wrong.
Miles Briggs.
Thank you, Presiding Officer. I'm sure the Cabinet Secretary will want to apologise to the families for the misleading picture which has developed around the spread of COVID virus in hospital wards. The fact that she has referred to 125 incidents when we know the number of deaths, here backbenchers heckling me about the deaths we have seen from COVID-19. But that is important that we get clarity from this government.
Okay, order. Let's hear the question,
can I ask the Cabinet Secretary, why did ministers decide to define almost 1,000 people as incidents? Will the Cabinet Secretary now also commit to publishing more accurate figures so that Parliament can have the true picture of what's happening in hospitals?
Cabinet Secretary.
So, Presiding Officer, I was actually, in publishing unvalidated data, attempting to be helpful. It is a lesson I have now learned. I, Mr Briggs, apologise to every single person who has lost a loved one as part of this pandemic. I think all of us should do that. All of us. Every single day. When we announce those numbers, we recognise that they are not just numbers. They are unique human beings who have been lost to their loved ones. And if you think for 1 minute that I do not spend just about every minute of my day thinking about the impact of this pandemic, then you are very much mistaken. What I will continue to do, Mr Briggs, is publish validated data from now on, because clearly, although in the GIQ, although in the letter, although in what I've just said to you, it is clear all the way through, these are suspected transmissions, suspected cases, suspected deaths linked to them, and that the validated data will be published, I hope, by the end of this month. Although all of that is clear, you have chosen to take unvalidated data and pretend that it is validated. Yeah. That is inexcusable. Inexcusable. And if anyone needs to apologise to the people of Scotland for sending them off on an unvalidated nonsense, it is you, Mr Briggs. It's certainly not me.
Miles Briggs.
Presiding Officer, the information was provided to the Herald newspaper by the Cabinet Secretary. Now, at the weekend, the Cabinet Secretary admitted that hospital staff are not yet being regularly tested. Even more worrying, no plans have been published on how this is to be carried out. Now, today, surgeons have warned that a fifth of patients treated for broken hips in March and April have gone on to contract COVID-19 whilst in hospital. Now, all of this at a time when only a third of our testing capacity is actually being used, Cabinet Secretary. We have known for months that routine testing is vital to stopping the spread of this virus. So will the Cabinet Secretary finally accept that the government's failure to test staff has also created this situation?
Cabinet Secretary.
So with respect to the orthopaedic comments that Mr Briggs has just quoted there, it is estimated. The key word here is estimated. When we do the validation of data, we will know how many of those cases, those staff, those deaths arose as a consequence of hospital-acquired COVID-19. And as Mr Briggs should well know, the fact of the matter is that COVID-19 has an incubation period of up to 14 days. So we needed to reach a definition of nosocomial infection for this particular infection, as we have done for all other infections that may be acquired in a hospital or healthcare setting. Having now reached that four-nation definition that complies with what the European Centre for Disease Control needs, we, HPS, now work through that data against that case definition, and they will publish that. And in that publication, we will be able to see whether or not that estimate is accurate or not. But it is an estimate. So suspected transmissions, estimated cases, if we are really going to do this job properly of leading this country through this pandemic, and if I may gently suggest, as opposition, scrutinising the government properly, then please do not take estimates and suspected data as fact. Take what is fact and then use it appropriately. And in terms of your point about testing of NHS staff, I have covered this already. What I need to know from the Chief Medical Officer's Scientific Advisory Group, from the nosocomial group that involves the Chief Medical Officer, some of those scientists from out with government, absolutely, and the Chief Nursing Officer, whether or not their view is that we should test all NHS staff, or should we test NHS staff, and it would be on a 7-day repetition, should we test all NHS staff in particular clinical settings? For example, cancer, outpatients, other clinical settings. Once we have that information from them, remember, from the outset, we have said, as governments across the UK have said, we will be informed by the science and clinical advice. Once we have that, I will make the decision about how we will institute that testing. I have already asked for a delivery plan to be prepared, ready for that information. And once that is done, I will make sure that Mr Briggs and members across this chamber are advised of what is happening.
Miles Briggs.
Presiding Officer, we are now 3 months into this crisis, Cabinet Secretary. Cancer services need to be able to have this testing in place. And after 3 months, we are not seeing that utilised. Scotland has a capacity of 15,500 tests a day, yet barely a third of these are actually being used. That is a national scandal, and we should be seeing ministers taking action to make sure they are utilised. Now, this failure has meant that people have entered hospital without coronavirus. They've caught it there, and they have died, Cabinet Secretary, when testing hasn't been able to be provided. So can I ask, Cabinet Secretary, in terms of where we are today, the development of Test and Protect, where has been Test and Protect for patients in Scotland?
Cabinet Secretary.
So, Mr Briggs, let me repeat, please do not, please, do not assert what you do not know. Indeed. So you are asserting, yet again, on the basis of suspected transmissions, that people have caught the virus in hospital and have died. You don't know that, neither do I. When the data is validated, don't mumble at me, Mr Briggs, please listen. When the data is validated, you will know it, I will know it, and we will deal with the facts at that point. And in terms of testing, using testing capacity, we have increased testing from a starting place of 350 tests a day in 2 NHS labs to now a capacity of 15,500. There is a point about using it for a purpose. Now, tomorrow, we will publish the data that I promised we would publish on the use of testing in our care homes, both asymptomatic staff and residents and staff in care homes where there is a case. And we will publish that every week. And we will see the progress that's being made by our boards against that national policy. When I have the clinical advice that I have asked for, then that will match the delivery plan that has been commissioned in terms of testing NHS staff. The other area of testing is all over 70-year-olds. That is underway, who are admitted to hospital. Surveillance testing, that too is underway, with plans to expand that. And the final area is those individuals who are symptomatic, who we are asking to go for a test straight away. Now, at the moment, I would not expect that number to be high, because we know, and you'll understand this, from the R rate and the published data, the level of transmission in Scotland at this point is much lower than it was. As we release lockdown measures, that is where Test and Protect is a vital tool, and we may see that particular number increase. You need to understand, do the homework, pay attention before you can assert what you do not know.
Monica Lennon to be followed by Alison Johnson. Monica Lennon.
Thank you, Presiding Officer. I think what the Cabinet Secretary needs to understand, and Miles Briggs, is that arguments in the Chamber won't bring back those people who have caught COVID-19 in hospital and who have went on to die. So let's stick to some facts, because I spent an hour on the phone today with a constituent who is absolutely heartbroken. Her mother was in hospital for several weeks, saw no one, was shielded from family and all visitors, was in a room on her own, and she died from COVID-19. It is on the death certificate. So families like my constituent, they need answers. In this case, my constituent wrote to the First Minister weeks ago, got a reply from an official and was told, if you're not happy, go to the Ombudsman. This is not good enough, Cabinet Secretary. So families do deserve answers, they do deserve an apology, and they absolutely need an independent inquiry to get to the bottom of this, and most importantly, so that we can have confidence that as we restart our NHS, people, patients and staff will be safe. Will the Health Secretary grant the public an independent inquiry, please?
Cabinet Secretary.
So I agree with Ms Lennon, absolutely I agree with her, that none of this arguing back and forward will bring back people who have died as a result of this pandemic, whether it is a result of nosocomial infection or whether it is the impact of the virus on them in another regard. And that is a huge matter of regret. And I also agree with Ms Lennon that people do need answers. And so when the data is validated, we can have a conversation at that point on two matters. First of all, around the actual numbers that we're talking about. Secondly, why do we think that happened? What is the nosocomial group doing and what are they telling us, me, but also you, because we will make that information available about how the virus was transmitted in that hospital setting. It may have, there are a number of possibilities there. I'm not going to speculate on them, but I'm sure Ms Lennon knows them as well as I do. So what is their view about how it could be transmitted? Therefore, what is their view about additional steps that we should be taking? Because I have asked them to do both. I've asked them not only to consider, once the data is validated, but they're considering it now, in what way do you think it is possible the virus has been transmitted in the hospital setting, and what more, other than what is currently being done with those red-green zones, or hot-cold, as they're called in some places, with the infection prevention and control, with the supply of PPE, what more do you think we need to do in terms of additional environmental cleans on top of it, Testing of staff absolutely is part of it. The wearing of masks in all clinical settings and in non-clinical settings, including in staff canteens and so on. All of that information will come shortly to me. I am very happy to share that with Ms Lennon and with others. And let's see then if there is more that we can do to do two things: to try and give an answer to her constituent and also to my constituent who wrote to me last night on exactly this matter, to all of those families, but also to be sure whether or not we are doing everything we need to do. That's what I want us to focus on. Whether or not there is an inquiry into any aspect of how this pandemic has been handled by any party, whether it happens in near time or in more distant time, will be a decision for another day. What I need to do right now, as I'm sure Ms Lennon would agree, is focus on what do we need to do to ensure that we mitigate and minimise the possibility of nosocomial infection in our hospital and healthcare settings. That's what I think we should have our next conversation about.
Thank you. There are 5 more members still wishing to ask questions. Alison Johnson to be followed by Emma Harper.
Thank you. There are scores of examples now of blanket testing detecting large numbers of asymptomatic individuals in the academic literature. Imperial College researchers advise that transmission from those tested can be reduced by 1/3 by routine testing, and the OECD are now advising regular testing for at-risk groups. Scientists are now calling asymptomatic transmission the Achilles heel of current strategies to suppress COVID. But while we ask questions in this chamber, potential asymptomatic carriers are walking around hospitals with the potential to infect patients and high-risk staff, such as Black and minority ethnic doctors and nurses. Does the Cabinet Secretary not agree that the ongoing absence of routine, regular testing in our hospitals is indefensible?
Cabinet Secretary.
Well, self-evidently, I do agree that the information and the evidence has now taken us to a place where testing of asymptomatic individuals in particular settings makes sense and is the right thing to do. That is why asymptomatic testing of care home workers in those care homes with no cases is part now of the policy, and the data will be produced tomorrow on the initial performance on that and then in subsequent weeks. It's also evident that I agree in terms of the healthcare setting. That's what I've just set out, I think, both to Mr Briggs and to Ms Lennon. So I agree that in particular settings where the clinical advice points me, then testing of those individuals, particularly staff who do not have symptoms, is the right precautionary measure, along with others precautionary measures, for us to take. But in doing so, we need to ensure that we have the right delivery plan to do that. So I've commissioned a delivery plan. I'm waiting on the advice from the CMO and the Chief Nursing Officer. That will be with me shortly. And at that point, we will begin to do exactly that in particular clinical settings, I expect. But whether or not it is wider than that, that advice will tell me what they think I should be doing.
Thank you. Emma Harper to be followed by Willie Rennie.
Thank you, Presiding Officer. Can the Cabinet Secretary outline what additional steps are being taken to better address and understand the impact of nosocomial transmission of COVID-19?
Cabinet Secretary.
So as I said in the earlier part of this, we needed to reach, as we do for every healthcare-acquired infection, an agreed definition of what would be a probable healthcare-acquired case or a definite healthcare-acquired case. And that, by and large, relates to, for each infection, their particular incubation periods. So the agreement across the 4 nations, so we're all doing it exactly the same way, is that a probable healthcare-acquired COVID case is when a positive sample has been taken after an individual has been in 7 days, more than 7 days, but less than 14, and a definite COVID healthcare-acquired infection is when a positive sample is taken more than 14 days after admission. So now we have that data, that is what we will use, or that definition, if you like, that is what will be used to validate the data. And that involves looking at the date of admission, the date of discharge for all of those cases, and including, of course, all of those staff. In addition, we have instituted, as Ms Harper will know, as I've said earlier, those at least 2 patient pathways in hospitals. That has been the case since we repositioned the NHS to deal with the pandemic. PPE, infection prevention and control, which is a central feature of our acclaimed Scottish Patient Safety Programme, and additional environmental and equipment cleaning. What I expect the advisory group to come back and suggest to me is both testing of staff in particular settings, but also additional environmental and equipment cleaning, and I expect the wearing of masks by healthcare staff in clinical and in non-clinical settings, where, for example, as I said, in staff canteens. All of that is designed to both protect the staff, but also to mitigate against transmission, particularly as increasingly there is a recognition about asymptomatic transmission, although that in itself is not every asymptomatic individual who is known to have the virus will shed the virus. There is still a great deal of scientific work going on to refine that and be sure about which symptomatic and asymptomatic individuals are infectious to others and which ones aren't.
Willie Rennie to be followed by Neil Findlay.
The Health Secretary knows that I've attempted to be sought to be constructive throughout this whole pandemic. But I have to say this whole episode of 125 outbreaks turning into 908 with 218 tragically dying has shaken my confidence in what the government is telling us. But what I want to know is what this means for restarting non-urgent operations in hospitals. Are the government on top of this, or will these people have to wait even longer?
Cabinet Secretary.
So let me explain the way in which the health boards report on suspected hospital-acquired infections is on the basis of incidents. And an incident is a case as 2 or more cases. So there was no attempt to dissemble here. That's how it's reported. That's how the information comes in. That's what was reported. And as soon as the question was asked, how many people might that have involved, the information was given straight away. There was, again, no attempt to dissemble. So Mr Rennie is absolutely right, and I am grateful to him. He has consistently, as have his colleagues, attempted to engage constructively, and I hope he feels that he's had a constructive response. But I don't think that what has happened here, where we are talking about suspected cases, unvalidated data, made crystal clear in every answer that has been given on this, can then be described as turned into that number of cases, that number of deaths, because we do not know that yet. We will know it when the data is validated. Now, in terms of what does this mean, though, in nosocomial infection and how patients might feel about the restart of the NHS, I think when I spoke last week in the debate on the framework for decision-making, I recognised Cancer UK's example and their request that patients should feel they had a safe place, a safe area, and that in part would be met by the testing of staff. There's also discussion underway by clinicians about asking patients in elective surgery in particular to self-isolate for 14 days before the date of admission. So all of that work is already underway in order to ensure that we offer patients and staff the safest possible route to the remobilisation of our NHS. And again, in what was said in the framework and in the debate, I talked about doing this safely. And safely is for both staff and for patients, and it will involve all of those measures I've already outlined.
Neil Findlay to be followed by Daniel Johnson.
No one underestimates the efforts of ministers or indeed their commitment, but it's our job to hold ministers to account for their actions and decisions. And it's a fact that this information has been withheld and delayed. It's a fact that advice from senior advisers has been kept secret, that FOIs have been blocked, and that parliamentary answers have been evasive. The Minister says do not assert. Well, the First Minister asserted that we have the greatest testing capacity in the world, and yet we are still miles behind. The National Clinical Director asserted that we had more than enough PPE when people were crying out for PPE. And the Cabinet Secretary herself asserted that 300 people had been discharged from care homes into hospitals untested, when it was actually 1,300. So isn't it a bit rich for the Cabinet Secretary to come here and lecture MSPs who are doing their job, holding government to account and claiming that these are unvalidated assertions, when that has been what the government has done all the way through?
Cabinet Secretary.
So I completely agree with Mr Finlay that it is entirely the job of every single MSP in this Parliament to scrutinise government and what government is doing, to question our decisions. But, you know, can I quote from an earlier exchange, round about the 17th of March? Not time for opposition parties to exploit the situation here or to use partisan and pejorative rhetoric against the efforts that are being made. So scrutiny is one thing, presiding officer, but lumping together a series of unconnected incidents and claiming they are connected is, to me, partisan and pejorative. And saying that something is a fact when all of the information that has been given has been clear that it is unvalidated data, and we're talking about suspected cases and suspected transmission, is not, to me, and my view alone perhaps, but that to me is not proper scrutiny. Proper scrutiny is based on factual information, and no one, but no one, could describe what this government has done as anything other than putting out the maximum amount of information, increasing week on week. This week, more information coming out on the testing programme in care homes, on Test and Protect, repeated every single week. Every week, more and more information. So the data goes out when it is robust, when we're confident. In this instance, to be helpful, I published unvalidated data. I will not do that again, because clearly all the caveats that surround unvalidated data are ignored, and the numbers are taken as fact, and that is entirely wrong.
Daniel Johnson.
Thank you, Presiding Officer. The Cabinet Secretary is absolutely right. We are not experts, but we should be listening to the people who are. She has already referred to the story regarding orthopaedics. Alistair Murray, the chair of the Orthopaedics Committee in Scotland, described the fact that the green pathways should have nowhere near the level of infection reported. In another story over the weekend, a senior cardiologist whose mother was refused admission to hospital because the care home said that it was unable to do so on the basis of guidance, described those policies as immoral. So I would ask the Cabinet Secretary to respond to these assertions by senior and experienced doctors who are raising serious questions regarding infection control and admission procedures, some of which on the basis of Scottish Government policy and guidance. And will she ask for an urgent, rapid and independent investigation into the policies and practices regarding infection control and admission procedures? Thank you.
Cabinet Secretary.
Well, the nosocomial group is independent, because although it reports to the Chief Nursing Officer and the Chief Medical Officer, it involves epidemiologists, viral specialists and others from our academic institutions and elsewhere. It is independent of government, as is Professor Andrew Morrissey's scientific advisory group, independent of government. So the information and the advice that we receive from them is independent. And I take very seriously what the group of orthopaedic surgeons have said, and I believe I have answered that. When the data is validated, we will see whether their estimated number, how that sits against the validated data, and we will have discussions with them, as we are having with all clinical groups, about the safe remobilisation of the health service. Because unless those senior clinicians agree that it is safe and proper to restart any of the procedures in primary or in secondary care, then it is not possible to do that. It would be wrong to do it, but it is not possible to do that. So that will take place. And in terms of the cardiologist, I think we have responded to this before. The care home's interpretation of what was in the guidance was wrong. No one who is clinically required, where the clinical assessment is that they should be treated in hospital, should be denied that hospital treatment. And both I and the First Minister have been consistently, emphatically clear on that. And the Chief Medical Officer has taken steps to ensure that that is clearly understood. Those decisions are not for politicians. They're not for managers of any description. They are for clinicians to take. And if a clinician says the right place for treatment for this patient is hospital, hospital is where that patient should go.
Thank you very much. Apologies to the members who weren't able to call there. Move on to question number 2, Colin Beattie.
To ask the Scottish Government whether it will provide an update on the guidance for passengers arriving in Scotland from abroad.
Cabinet Secretary Hamza Youssef.
Presiding Officer, I announced on the 7th of June that the Scottish Government would be introducing public health measures at the border on Monday the 8th of June. These measures will apply to international arrivals to Scotland, whether they are residents or indeed visitors. These temporary measures, taken as part of the Four Nations public health approach, require arriving passengers to provide contact details and travel information, as well as self-isolate for 14 days. There will be a very limited number of exemptions, including for those working on critical infrastructure and transportation. The measures have been taken to support a continued effort to suppress the virus and will be reviewed on a 3-weekly basis. Further guidance on what to do when travelling to Scotland is available on the Scottish Government's code.
Colin Beattie.
Thank you for that. We've seen reports in the media in recent days of so-called travel corridors between the UK and other countries. Has the UK Government consulted the Scottish Government on this?
Cabinet Secretary.
There's not been any consultation or discussion with the UK Government as of yet on any air corridors. I should say and make it abundantly clear that any exemptions or any air corridors that were to be developed would have to be within the Scottish regulations. Therefore, is not something the UK Government could do unilaterally. It would have to be done by the Scottish Government via the Scottish regulations.
Colin Beattie.
Perhaps I can ask the Cabinet Secretary to elaborate on how the guidance issued in Scotland might differ from the rest of the UK nations.
Cabinet Secretary.
Generally speaking, between the four nations, but there also has been to create differentiation where appropriate to the circumstances here in Scotland. So there are minor differences, I would say, in relation to the exemptions. So, for example, reflecting Scotland's needs, there are differences, for example, for seasonal soft route workers. When it comes to the enforcement measures as well, there are some differences, but again, they reflect the different legal jurisdictions that we have here. And all of those exemptions that are different here in Scotland have been discussed with the appropriate stakeholders, be they Police Scotland, Public Health Scotland, the Crown Office, Procurator Fiscal, or indeed business and industry. So there is a full list of exemptions that apply in Scotland available on the Scottish Government website.
Thank you very much. The sound quality is not of the best, but I think we're going to persevere. Kenneth Gibson, to be followed by Liam Kerr. Kenneth Gibson.
Thank you, Presiding Officer. Does the Cabinet Secretary agree that allowing people to travel from Ireland, where almost 1,700 people have died of COVID-19, without quarantine, while imposing it on Norway, Iceland or Singapore with a fraction of Ireland's death rate, to name just some countries, is just daft? Understand that visitors cannot just stop off an island for a day or two on their way here to avoid quarantine restrictions. But how can the Cabinet Secretary advise the Chamber as to how this will be monitored?
Cabinet Secretary.
On Ireland are exactly as Kerry Gibson describes it, in the sense that anybody trying to attempt quarantine will not be able to do that. Even coming in via Ireland and then coming into Scotland, they would have to isolate and self-isolate for 14 days minus any period of in Ireland. In terms of how that will be enforced, there will be spot checks by border forward. In terms of any further enforcement, Police Scotland will, in their normal course of duties, if they come across anybody that is breaching self-isolation, they will have the ability to enforce that with a fixed penalty notice of £480, and if necessary, escalate that to the procurator.
Liam Kerr.
Presiding officer, on the differences that were discussed earlier, the maximum fine for breach of quarantine is £1,000 for the rest of the UK, but only £480 in Scotland. Now, the Cabinet Secretary is on record as saying that the lower fine is because of our distinct fine system, but an exception could quite easily have been carved out in legislation, as has been done for several issues since this outbreak began. So will the Cabinet Secretary confirm that this was a policy choice by the Scottish Government, and can he justify it?
Cabinet Secretary.
Very much. Because it was done in collaboration, conjunction with colleagues both in Police Scotland and indeed the Crown and Procurator Fiscal Service. So they're not unilaterally by just the Scottish Government, but in consultation with important partners. And I think if we had imposed a £1,000 fine here, reporting people to the Procurator Fiscal as a first step in relation to breach of any self-isolation measures, I think would have been a very heavy-handed and disproportionate effect and measure to.
Thank you very much. I think we all appreciate this is a bad connection and also the volume's quite low. So could I ask members not to mutter in the background because others will be wanting to listen to Mr Youssef's answers. Well, we'll take the next question. Question number 3, James Kelly.
Thank you, Presiding Officer. To ask the Scottish Government what arrangements are being made to enable prisoners to have contact with their families during the COVID-19 outbreak?
Cabinet Secretary.
Before I answer the question, if you wish, in between questions, I can try reconnecting to perhaps my mobile phone hotspot and seeing if that is a better link. I don't want to deny members any opportunity to ask questions, but I'll leave that. In terms of the answer to James Kelly's question, of course, I recognise the value and importance of family links and the impact that restrictions, particularly the suspension of visits, can have on those that are in custody, but importantly also on their families. The Scottish Prison Service has been working hard to introduce a variety of different initiatives to enable contact between those in custody and their families during the COVID outbreak. Next week, virtual visits will go live at a number of sites, allowing those in custody and their families to have video calls. This scheme will then be rolled out across the prison estate in the coming weeks. In addition, loans are being introduced across the prison estate as another way of maintaining during this difficult time. Interventions to the prison rules to allow this to happen are being laid week with the rollout of phone staff. The email prisoner service is available in all prisons, as is prison voicemail, which allows those in custody to listen to messages from friends and family.
Thank you very much, Mr Youssef. Mr Kelly's permission, I'm going to end it there. We'll try and reschedule this question if possible, but it's quite clear that the reception is getting worse rather than better. And I think actually I could hear most of the answers, but I appreciate that the broadcast system wasn't coping and most members couldn't hear. So hopefully those listening on the channel will actually have heard it better. Cabinet Secretary, thank you very much for that. We're going to conclude the topical questions on that point. We might reschedule that question for another time. Thank you.
I think you've actually covered what I was going to raise in terms of the fact that it's very important for members of Parliament to be able to scrutinise Scottish Government ministers in this way, and that if we can't hear the answers to some very important questions, then that scrutiny it falls on its face, really. But I think you've covered that in your intervention.
Thank you, Mr Hamilton.